Oxygen supply. This is the coupler, and this is the sealing central gas supply. There are only one coupler that will fit into one outlet, so this is specific for oxygen. If I tried to take a different compressed gas like compressed air or nitrous oxide, the coupler would not fit into the coupler that's coming out of the ceiling or on the wall. That is, again, a safety mechanism that human medicine developed to try to ensure that you are using the proper gas that you expect to use. So that's hooked up. I don't have the central oxygen turned on. This is a monkey wrench that is what you use to turn on the E-cylinder. Just have to be able to put it on there. Counterclockwise turns on the cylinder. Clockwise turns it off. Okay? Counterclockwise turns it on, and I don't have that much oxygen in this circuit, but this pressure gauge right here is telling me how much pressure is in this E-cylinder. So I have right at 500 psi in this particular cylinder. One of the questions in there is to go look at 5 different machines and look at the pressure gauge, and then do that calculation to figure out how long this E-cylinder is going to be good for. I will tell you that from a clinical standpoint, if this is on the red area, right at 500 or less, we're going to change it out. We're not going to trust it that this is enough for any length of time. Okay? But for pressure checking, it's going to be fine. So our circuit is on. So this is what I want you to do as well. Trace the flow of gas, and you can see that from the hanger yoke, it's going to go to the regulator. The regulator is what takes the cylinder pressure. So what was the starting cylinder pressure in here?
500.
Okay. What? Oh, no, you're right. So this is reading 500 psi pressure right now. What is it when it's full?
16.
That's liters. What's the pressure when it's full? 2200 psi, right? So if I had a full E-cylinder attached to this machine right now, this regulator's job is to reduce that pressure to 50 psi. So regardless of what's in this cylinder, this regulator's job is to reduce it to 50 psi, and that's a safety mechanism because that's all the higher pressure we want coming into this circuit, okay? So that's the job of the regulator. It's boring because you can't see what's going on, but that's its job, okay? And then of course this pressure gauge is what you are using to indicate how much pressure is in your cylinder. And then you've got an oxygen line. So that's coming up to the back of the flow meter. Now we have a Y splitter here because these machines are set up to be able to use oxygen from an E-cylinder or a central gas supply. That's not something that's required for a machine. So if you work in a Practor that doesn't have central oxygen, you're not gonna have this Y splitter. When oxygen comes into the back of the flow meter, its pressure is further reduced to about 14-15 psi. And that is the pressure that's coming into the circuit and going to the patient, okay? Now, if you trace the flow of gas from the flow meter, so gas comes in, goes out the flow meter, comes over here and goes into the vaporizer, or there's this hose right here that's coming off the flow meter, and this is your flush valve. Sorry, hard to see. Okay, so that's your flush valve. Notice how it is kind of teed off from the back of the flow meter because it does not go into the flow meter or vaporizer. It has its own little port. So when I push that, that is the flush valve, and you'll notice that the hose goes behind the vaporizer and goes right into the circuit. Okay? That is why it is not including the flow meter or the vaporizer. It's dumping 100% oxygen into your circuit. So, again, follow the flow of gas out the flow meter. It comes down, goes into the vaporizer, picks up its inhalant vapor, and it goes out the vaporizer output. Now remember, on these machines, that is your common gas outlet port, okay? Now remember, on this side of the hose, it's your common gas outlet. What's its name on this side? Fresh gas inlet, right? So you'll see, yeah, let me see if I can, there we go. Well, sort of, okay. So that's the flush valve there. This is the common gas outlet. This is what hooks into the vaporizer, and this is what goes into the breathing circuit, okay? So, all of our fresh gas inlet lines on these machines have this adapter. When this adapter is together, your circuit functions as a rebreathing circuit. When you have it detached, we can attach the fresh gas hose from our non-rebreathing circuit here, and that takes all of the breathing circuit out of the circuit, and we're just using that, okay? So we're gonna do rebreathing first, okay? So, gases enter the breathing circuit. By gases, I mean inhalant and oxygen at the fresh gas inlet. They're gonna flow into here. This is your inhalation one-way valve. We'll have breathing hoses here that will direct gases towards the patient on inhalation. Then the patient exhales through the exhalation tube that's attached to the exhalation valve here. And this is the exhalation one-way valve. We have a reservoir bag that goes here, and that's just a reservoir for the oxygen and inhalant so that we can give the patient a breath if we want to, or we can use it as a way to monitor their respiratory rate. The gases are going to flow from exhalation into the CO2 canister. And I have an empty one here. So the way these machines are designed is the gases will flow over the top here, go through the granules, and then they go through, let's see if I can pull this out. Okay, so they flow through here, through these valves, and then they come out the side, and then the gases flow back up through this port, and they're gonna come back up this tube. And if you feel down here, like when you take your CO2 canisters off, you'll see that there's a port for this to go into. And so that's right about here. I wish we had one that had like a clear thing over it so we could actually see it. But the gases are gonna come back up, and they're gonna do one of two things. If there's excessive pressure buildup in this circuit, it's gonna go out the pop-off valve. And this is where your scavenge system attaches to your pop-off valve. Or the gases are going to be diverted back to the inhalation one-way valve to be rebreathed by your patient once the CO2 is extracted. Any questions on that? Okay. So, if the patient is spontaneously breathing, that is pretty much the flow of gas. It will come back up here. There'll be a reservoir of gas that sits in your reservoir bag, and some amount of gas will go out into your pop-off valve and some will be rebreathed. How much gas goes out into the scavenging versus being rebreathed is going to be dependent on what you have the oxygen flow meter set to. If you have this excessively high and it's producing way more oxygen than what that patient needs, the majority of your gases are going to go out into your scavenge system. So all you're doing is wasting inhalants and oxygen. Okay? It's not benefiting the patient to be delivering more oxygen than what they need. And that is why a rebreathing circuit has those different levels of oxygen flow based on the patient's metabolic oxygen demands. Okay? If it's going to flow out the scavenge system, you have two options. This is your F-Air canister, which is your passive scavenging system. And this device is filled with activated charcoal. There is a filter on the bottom of this. So that is why these canisters must remain upright, and that filter on the bottom cannot be occluded. When you put your scavenge hose on top, that will push the gases through the activated charcoal, and that will adsorb the inhalant, and then the fresh gas comes out the filter and into the room. If this activated charcoal is expired, all we're doing is putting our waste anesthetic gas with the inhalant vapors into the environment, and we're sitting there smelling it, which is not good for our health. So you want to make sure that these are within the proper weight and that we are checking them consistently to ensure that if they've gained 50 grams, we have replaced it. Another option, if you have it piped into your practice, and this obviously is so if you have an active system, you would pipe into that, And then what that means, and we have them here, is upstairs there is a suction fan that is pulling the gases out, and then it is sending it out an exhaust pipe up there in the ceiling. So it's still going out into the environment, it's just not right around us where we're working with the machines. Okay? So that is pretty much the rundown of the machine. Any questions?
For the activated charcoal, were you saying it's like an expiration date or it has to be a certain weight?
Weight, it's a certain weight. So when you first get these canisters, you weigh them in grams, and then after every use, you should weigh it again. So for junior surgery, the students weigh them before and after use, and we keep track of the weight gain. And once they've gained 50 grams, we discard it and get a new one. So for the cats, we use those because we can pretty much go the majority of the semester without having it gain 50 grams. For the dogs, we're gonna start piping into the active scattering system because it's used a lot more just because of size. Any other questions before I show you breathing circuits? Okay. Get some of these hosed up. Oh, before I do